Lagerstroemia speciosa, commonly known as Banaba, is a tropical tree widely grown in the Philippines. Traditional practitioners use it as a natural anti-diabetic agent. It's also used to help with weight loss. Water and alcohol extracts of the tree's leaves are sold in capsule form, and they're used to help to lower blood sugar levels and to promote weight loss. The capsules often contain other substances like green tea, green coffee, tamarind, black pepper, and/or metals like vanadium and magnesium. Banaba leaf extract's active component include corsulic acid, lagerstroemin, and gallatannins. The corsulic acid lowers glucose in several animal and human trials, possibly by activating cells in the body that take up high amounts of glucose, by discouraging the body from breaking down starches or sucrose into glucose molecules, and preventing the body from making glucose for energy from non-carbohydrates. It also lowers fat levels like triglycerides and LDL or bad cholesterol. It contains allagitannins, a type of molecule that's present in many common fruit and nut, like pomegranates, strawberries, and almonds. Allagitannins, like lagerstroemin, can increase glucose transport activity by activating glucose transporters and promoting the production of more signaling or transmission molecules. The transmission molecules, like NF-kappa B and MAPK, along with others, help cells to absorb glucose and to use it for energy. One of Banaba's key gallatannins discourages fat cell production, or adipogenesis, in cell studies. Gallatannins are a type of tannic acid, the class of compound found in red wine, which reduce blood sugar in diabetic patients. These mechanisms have led some researchers to call for deeper investigation into Banaba's anti-diabetic potential. Banaba is a tropical tree with leaves rich in antioxidants and polyphenols, and is currently under investigation as a potential powerful anti-diabetic aid. Banaba leaf can help to lower blood sugar by increasing glucose tolerance. It can decrease glucose production in the body by up to 30% and decrease the breakdown of storage molecules like starch and glucagon into glucose. Unlike many anti-diabetics, Banaba has not been observed to promote weight gain. In a year-long study, 15 diabetic patients took 100 milligrams of pure water-soluble Banaba extract pill daily. At both 6 months and 1 year, the patients had significantly improved glucose tolerance. At the end of the year, they had up to a 16% decrease in their blood sugar level, but they did not have low blood sugar or hypoglycemia. In another clinical trial, 24 patients with mild type 2 diabetes were given 3 tablets containing a mix of Banaba, green tea, green coffee, and garcinia or tamarind 3 times a day. The patients had an average blood glucose decrease of 13%. In another 2-week study of 10 type 2 diabetic patients, the subjects took 32 milligrams or 48 milligrams of Banaba capsules with a 1% concentration of corsulic acid daily. At the end of the clinical trial, they had a 30% decrease in blood sugar levels. People with pre-diabetic insulin resistance can also benefit from Banaba. In one clinical trial of 80 pre-diabetic adults, the Banaba extract improved insulin sensitivity, and it preserved pancreatic beta cell function over 12 weeks. However, Banaba did not reduce the degree to which the blood sugar spiked after a meal. Further clinical trials are needed to determine how useful the Banaba can be in controlling insulin resistance and preventing the progression into diabetes. Taking Banaba leaf extract reduced blood sugar and improved insulin sensitivity in multiple clinical trials. A common side effect of diabetes is weight gain, and unfortunately many anti-diabetic drugs prescribed to decrease blood sugar also seem to promote fat deposition. Banaba leaf, by contrast, has not been shown to increase the weight gain. Some researchers have suggested Banaba may prevent the glucose storage molecules like starch and glucagon from breaking down. In combination with green coffee bean extract and vitamin D3, Banaba improved markers of body composition, both fat mass and free fat mass, in 30 volunteers with diabetes. It also decreased the production of fat cells, or adipocytes, and it lowered cholesterol and triglyceride levels. In a 60-day pilot study involving 30 participants, tablets containing a mixture of Banaba, green coffee bean, vitamin D3, and moringa lowered the body fat levels compared to placebo. Banaba leaf extract reduced superoxide levels in rats. Superoxide, if left unchecked, can prevent cells from functioning properly, and it can increase bacterial survival rate at an infection site. In diabetic mice, Banaba extract helped to increase the levels of catalase, an antioxidant enzyme in the body. The catalase helps to neutralize hydrogen peroxide, a harmful reactive oxygen compound. Banaba leaf extract contains gallotannins, and these are a subclass of tannic acid. Tannic acid, the component of Banaba, inhibits the production of endothelin-1, a protein that's heavily involved in heart disease. A treatment with 0.072% coralic acid, a major component in the Banaba, significantly lowered blood pressure in hypertensive rats. Non-alcoholic steatohepatitis is a liver disease, and it causes excess fat buildup in the liver. Excessive fructose or sugar consumption is a major cause for this disease. In rats, Banaba extract decreased liver damage in the rats with the steatohepatitis, and it lowered the total cholesterol and the blood ALT levels. Coralic acid from Banaba leaf helped to prevent inflammation by inhibiting arachidonic acid formation in mice. This prevented prostaglandin and leukotriene formation. Prostaglandins are the hormones that induce pain as a side effect, and leukotrienes are cells that release inflammatory cytokines. In cells, Banaba extract blocks the activation of the inflammation-causing NF-kappa B. Banaba leaf extract has inhibited inflammation in animals and in cell studies. Coralic, gallic, and ellagic acid in Banaba leaf extracts inhibit enzymes that viruses use to take over human cells, proteases and reverse transcriptase. In cells, these acids help to prevent viral infection from pathogens, such as the human rhinovirus and HIV. The clinical usefulness of the activity is unclear, as it's never been tested in living animal models. In a bacterial study, Banaba leaf extract, derived from water instead of alcohol, successfully impeded the growth of harmful bacteria like Staphylococcus aureus, Bacillus subtilis, Pseudomonas aeruginosa, and E. coli. The antibacterial activity was shown to be possibly caused by the tannins and the triterpenoids in the Banaba. Coralic acid is one of the main components of Banaba, and it's under investigation for its potential to kill isolated colon cancer cells in a lab setting. Coralic acid has also been found to inhibit TPA, a compound that promotes tumor growth. Based on this result, researchers may test whether extracts or active compounds of the Banaba could prevent cancer development in animal models. No adverse side effects have been found in clinical trials, contrary to the logical expectation that the blood sugar lowering capacity of Banaba would cause low blood sugar or hypoglycemia. 6 clinical trials did not lead to any such effect. Herbs like fenugreek, garlic, guar gum, or horse chestnut, which all help to lower blood sugar levels, along with diabetic medication, theoretically could enhance the effects when taken with Banaba. Various studies have used 32 to 48 milligrams per day of Banaba extract with a 1% coralic acid concentration. However, there's no set standard, and the dose recommendations can vary depending on the product and the percentage composition of the Banaba in the pills. For use with children, a doctor should be consulted beforehand. Banaba is a tropical tree, the leaves of which are full of antioxidant polyphenol with the potential to improve insulin sensitivity according to clinical trials. In humans, Banaba has also reduced blood sugar and inhibited weight gain, while animal and cell studies have begun to investigate the potential antimicrobial and anti-inflammatory activity. Banaba leaf is generally considered safe to consume, though its safety profile is incomplete in pregnant women and children. Theoretically, it could interact with other compounds to reduce blood sugar, though this has not been demonstrated. For more information about herbs, supplements, and natural treatment plans, check out my website.